Now we'll talk about the clinical importance of the next artery before us, and this is the medial plantar artery. Medial plantar artery. So this is what we call the medial plantar artery. So the clinical importance is more of like, okay, what are the medical conditions that could affect this artery? Okay, thereby giving reasons why we study the artery. So it's very important because of the blood supply to the foot, So the terminal branch of the posterior tibial artery, So of course, if it is affected, the blood supply could be disrupted. Okay, so surgical relevance is very important in all those foot and ankle surgeries, all those bunionectomy, tendon repair surgeries, reconstructive surgeries. So once you are doing all those surgeries, you must always try to reserve or preserve this artery, right? Because that when you injure it, the blood supply to the toes can be cut, thereby leading to ischemia. So we got. So it's also used in flap surgeries, okay, for reconstructive coverage of defects in the foot and other regions. Okay. Medial plantar artery. Medial plantar artery. So it also gives us a lot of branches that these branches get to interconnect with different blood vessels around the foot, thereby, maintaining the blood supply there. So it ensures the collateral blood supply to the toes. Collateral simply means that if one vessel is affected, this other one can actually come in for it. So imaging and diagnosing, of course, if I'm dealing with foot issues, mainly issues that have to do with the blood supply is cut off, I can still access, I can still use I can still use this blood vessel to access how the blood supply at the foot is still being maintained. So injury risk, as you are walking with your leg, you can step on nails, you can step on sharp objects. You could actually injure this artery too. So that's what we got for medial plantar artery.